to our next episode of the Hormone Café. Today, I want to talk to you about how IV therapy can benefit your fertility. The genesis of this project came because I do a lot of nutrient testing, and oftentimes my patients come back with really low nutrients, whether that's folic acid, B vitamins, vitamin C, which is an antioxidant, glutathione. And sometimes we think, okay, we're maxing out everything in your diet. You're taking all these supplements. How is it possible that you're so low in these things? And so the things that we think about then are, is it because your gut isn't metabolizing your capsules properly? Is there a reason that your nutrients aren't getting absorbed when you're taking supplements or when you're eating? So while we're working on our digestive system, which is extremely important, of course, food is the essence of everything we do. So if we're low on antioxidants, we want to make sure we're eating enough antioxidants, but sometimes our gut is really, really off. And in that process, when we're trying to repair our gut, get it to absorb nutrition better, I thought, well, we should just give some of these nutrients through an IV, because then we can give people vitamins and antioxidants and hydration right to veins, so that we can bypass the gut, bypass the liver, and really boost energy and metabolism and egg quality even faster. So I launched into this whole project, and now here at Vera Health and Fertility, we offer IVs. So some of the IVs that we offer, for example, we have an egg quality IV. Because when I was testing people's nutrients, there were so many antioxidants that kept coming back low, and the most important thing for your egg quality is antioxidants. So it's great because now we can give an IV with lots of different antioxidants to really help rejuvenate your eggs and your egg quality from many different pathways. Because egg quality, it is hard to rejuvenate. We are born with all the eggs that we're ever going to have. Our egg quality does decline over time. There's tons of things that we can do to help improve our egg quality, and doing IV antioxidants is one of them. So in addition to our diet and our supplements and any medications that we're on, we can also do IV vitamins. So you can do an egg quality IV once a week, once a month, however that makes sense in your fertility journey. But you come to the office, you sit down for an hour, you have an IV go into your arm. We give glutathione at the end because glutathione is a very powerful antioxidant, and it also helps push toxins out of our cells and into our bloodstream so that we can detox faster. So I was super excited because now we can do an IV for egg quality. And then the other IVs that we developed one for implantation, because one thing that I was finding are, I have some patients who have recurrent miscarriage, chronic endometritis, chronic infections, inflammation in their uterus, and it's hard to access some of those things through antibiotics and diet, and sometimes you need multiple modalities to help with that kind of thing. Or patients who have thin uterus linings, where you're taking all these medications, you're eating really well. Is there anything else that we can be doing? So we developed an IV that's full of vitamins that improve blood flow to the uterus. So in addition to supplements and eating and medication, we can give you nutrition through an IV to help that blood flow to your uterus to really help with implantation. So that IV we give before and after ovulation, so we can improve blood flow before and after ovulation to really help with that implantation. And then another IV that we developed is for surgery, because I'm really passionate about getting people back to health as quickly as possible after surgery, because our whole goal is to be restorative and never be made worse. So when I do surgery, my whole goal is to restore your anatomy, restore your egg quality, restore your fertility, prevent scar tissue, and not make anything worse. And so I tell my patients that they have to act like they're training for a marathon if they're going to have surgery. So we have to be eating really well, not having sugar, not drinking alcohol, not taking ibuprofen and some of those specific pre-surgical instructions. But then in addition to that, we developed an IV. We have a pre and a post-op IV to really promote healing. So it gives vitamins, it gives antioxidants in order to make sure that we're nourishing ourselves as much as possible and hydrating, because one big thing about surgery is that it can be very dehydrating. One, we don't let you eat or drink anything after midnight. And then two, sometimes when you wake up from surgery, the last thing you want to do is drink a whole bunch of water or hydration. So we also give electrolytes in that IV just to make sure we're covering our bases as far as getting you healed and rejuvenated as fast as possible. So now into our surgical program, we've incorporated a pre and a post-op IV to make sure that we're doing everything possible that if you have fertility sparing surgery, that you can get back to yourself as quickly as possible and help your blood flow, help your eggs, help your body recover from the stress of having the surgery. And then we did not leave out guys. We also developed an IV for sperm quality, because some of the things that are similar between men and women is that men also really need antioxidants, because that has a lot to do with the morphology. We want guys to have sperms that have one head and one tail, not three heads and two tails. That's known as morphology. We also want the sperms to be swimming quickly, that's motility, and something called progressive motility, which is how fast sperms swim. And then we want sperms to be well hydrated and not agglutinate, meaning not stick together. And then also, in order to promote proper sperm growth, we do need excellent blood flow to the testes. So we developed an IV where we help with blood flow, we help with hydration, and then we help with antioxidants to make sure that that sperm quality is as healthy as possible. And guys can also do those once a week or once a month, just depending on their sperm quality. So we have them come in, we have them get an IV for an hour, and it just helps really rejuvenate them. And you're not out of the woods. You still have to eat really good. You still have to take your supplements. But sometimes guys feel like they've been doing all these things. They've changed their diet. They've changed their supplements. They've done multiple semen analyses. They still have a little bit of a low morphology. What else can we possibly be doing? Having an IV can just help boost that, especially if you're in the camp of feeling like you're really doing a lot of the other things and you want to make sure there's no other modalities that you're missing out on. So those are some of the things that we developed here just to really round out all the different ways that we can be promoting your fertility, your hydration, your antioxidants, your blood flow. So if you're the kind of person who you think, okay, I've done a lot of diet things, I'm doing all these changes, my lining is still thin, or I want to just optimize myself to make sure we're preventing miscarriages, making sure I'm doing everything I can to promote my egg quality. I want to make sure that my sperm are healthy. If you're here in Colorado, definitely come check us out. We would love to see if IV therapy is a good fit to help rejuvenate you. And if you're not in Colorado, consider IV therapy as something that could be an adjunct to your treatment, because we can see if we can get really excellent nutrition right to your IV in addition to what you're doing in supplements and in addition to what you're doing from food. So if you have questions, definitely check us out. VeraFertility.com. If you're the kind of person that you feel that you've been doing all kinds of things and you want just a little extra support, definitely consider IV therapy. And stay tuned for our next episode of the Hormone Café.